I'm Dr. Rose Cheng. I'm a perinatologist and I deal with high-risk pregnancy women.
Hi everyone, I am Dr. Sarapuddin. I am a neonatologist and I take care of babies delivered prematurely.
Okay. Most of the time in the clinic, we do get a lot of questions and cases about preterm birth, which is why today we're going to be debunking prematurity myths. It is not safe to exercise while pregnant, or safe ba mag-exercise ang pregnant woman? Okay, the answer to this is it's an outright yes, but you always have to also be cleared and you have to discuss this with your OBGYN. If you're going to tell me that you have hypertension, you delivered prematurely before, or you have a cervix that's incompetent, all of the risks that puts you on X mark for the eligibility to exercise, hindi na. But if you're a low-risk patient, you have no illness, and more importantly, you've been exercising before, nag-exercise ka na dati, then okay lang. Just not the cardio. So there's 3 established safe forms of exercise in a pregnant patient, and that's walking, prenatal yoga, and swimming. So can exercise. It actually gives them some breath of fresh air to exercise.
Right.
Diba? Happy endorphins yun.
Yes.
Next question.
Okay, a late preterm baby is almost like a full-term baby that is just a few weeks short. Well, totoo nga naman, a few weeks short. But
what's one day between friends?
I know, right? Well, first let's define what is a late preterm. So late preterm, our babies born at 34 weeks until 36 weeks, 6/7 days in gestation. So they actually account for a significant portion of preterm delivery, right? So over the years, research has shown that this particular population have a unique physiology and pathology that makes them at risk for developing respiratory disorders, thermoregulation, feeding difficulties, hypoglycemia. They actually have a unique set of needs and challenges. So I think they should be recognized as at-risk population and should be treated differently compared to their less mature and more mature counterparts.
So in other words, you don't just dismiss them as, ay wala lang, okay lang yan, mommy. Hindi. So
1 week lang naman, so can't say that.
So we cannot make them be complacent with regards to paano ba alagaan si preterm baby. Ba't ang mahal ng singil dito sa ospital na to? Pero okay, huwag na natin sabihin yun kasi walang kinalaman. Next question. A whitish vaginal discharge is a sign of preterm labor. Okay. This is not a fact. It's a myth. Simply because all women, whether they are pregnant or not, will have a whitish vaginal discharge. And that whitish vaginal discharge is normally seen in ovulation, in an ovulatory state, when a female is fertile, and then also when she's pregnant. But if the hygiene is poor, and that whitish discharge is just there, sitting, it can cause preterm labor because it will invite the growth of your friendly microorganisms, and that's notoriously the yeast infection, sometimes your bacterial vaginosis. So most of the time when we have this and the patient will tell us this, we always ask them a 20 set of questions, and that would include, is it watery in nature? Is it blood tinged? Because if it's watery in nature, baka bag of water na po nyo yan. Or if it's blood tinged, obviously that's not normal. Blood is never normal during pregnancy, so it might be a sign of preterm labor. There. So not always the case. We have to ask further questions. The point here is please see your doctor. This is Dr. Rose Cheng.
And this is Dr. Soraya Sarapuddin.
We are from the Medical City, taking care of you.